At midnight on Sunday night, Austria went into a new pandemic lockdown, but only for its unvaccinated population. It's in response to a record surge in COVID-19 cases that the government says threatens to overwhelm intensive care units. For 10 days, millions of people will be required to stay at home unless their journey is deemed essential. Crowds took to the streets of the capital, Vienna, to protest what they say is a vaccine mandate by the back door.
They chanted for their freedom outside a fortified Chancellery, but under the new measures they will have to stay home. The protesters were there to make their hostility to the new lockdown heard.
I'm here today because I want to fight for my rights. These measures are absolutely discriminatory, starting with the legal obligation for health workers to be vaccinated. Which occupational group will be forced to next? My body, our bodies, we have the right to decide about them. It's totally discriminatory what's happening here.
But in a country entering the fourth wave of the COVID pandemic, not all are opposed.
Basically, I'm okay with the measures, but I'm quite sceptical concerning the implementation and how they will police it. All unvaccinated should get vaccinated because they don't know what damage they can cause.
Speaking on Sunday, the country's Interior Minister had a stern warning to the Austrian people.
As of tomorrow, every citizen, every person living in Austria must be aware that they can be checked by the police at any time. Among other things, we will also check if people have been vaccinated or recovered and the reason for entering public spaces.
63% of the population have currently had both jabs, with Chancellor Alexander Schallenberg calling on those still unvaccinated to take up the offer of a shot.
We have to increase the vaccination rate. It's shamefully low. With this vaccination rate, there's no way out of the pandemic. We'll get stuck in a vicious cycle. We'll go from lockdown to wave, back and forth. That cannot be our goal. That cannot be what we want.
Those who currently haven't received 2 jabs will only be permitted to leave their homes for work and to carry out essential tasks such as shopping and attending medical appointments. The announcement comes following a record surge in COVID infections and government concerns hospitals could become overwhelmed.
Steve Chade is a journalist with Austria's public broadcaster, ORF. He joins us from Vienna. Welcome, Steve. How are these measures to be enforced?
Well, we're talking about 2 million people in the country who are unvaccinated, so it will, of course, be quite a challenge. But the Interior Minister, Karl Nehammer, says the police are being given more support. They're going to be out in greater numbers. They've been equipped with tools to be able to immediately test people. They have a special app on smartphones so they can read the QR codes for people who are vaccinated. For people who are not vaccinated, they don't have the so-called green pass, and if they are found to be in violation of the lockdown for the unvaccinated, they'll be facing fines of up to 1,450 euros. So a huge challenge, but the police are being given more support to carry out these controls.
And what about those people who have only had the first dose of their 2 shots?
The message from the government is that this is sort of encouraging compliance. So if you've had 1 shot, you can get a PCR test to sort of test into the ranks of compliant people. So they won't be penalized. So if you can show the willingness to comply, then you can join the people who are not in lockdown.
Right. And where is Austrian public opinion on this? The country's infection rate is at a record 800 cases per 100,000 people.
Astounding, way too high, and that's why the government is moving now. For the 65% of the population that is vaccinated, there's great support for this. They say this comes too late. We're in the throes of a 4th wave. We shouldn't be here. This was avoidable. So, yes, for 65% of the population, they're saying, yes, something needs to be done. The infection rates are way too high. The hospitals are under intense pressure. Intensive care beds are way too full. And that means these beds, these hospitals should be there for everybody. But now these intensive care beds are full of COVID patients who didn't need to be there. If they would have complied early enough, then the hospitals would be in fine shape. And this is a genuine crisis. Healthcare workers went on strike for a short time last week. They're overwhelmed, and they say they have no perspectives at the moment. So hospital workers are leaving the profession. More patients are coming in, filling intensive care units. This is a genuine crisis situation. The government was forced to do something. Just a final note that this might not be the end. More measures are under consideration. We'll know in a couple of days if maybe we're going to have a nighttime curfew for everyone in the country. So watch this space.
All right, thank you for that, journalist Steve Chade in Vienna.